I was told in medical school that studying medicine is as much of an art as it is a science. So earlier this week, I got my paintbrush out and went undercover to reveal the hidden reason for your low energy.
Hi everyone, my name is Mia. I'm going to be your instructor today here at Paint and Sip Studio, New York. I am so excited that you're here for our mystery painting today.
I'm about to crash a paint and sip class where literally they paint and they sip. They have no idea what they're painting and they have no idea I'm the guest teacher today.
We're gonna go across and we're gonna go up. Connect these two lines with one final line length. When you're doing these lines, you wanna use nice long strokes.
Surprise! Surprise! Would you mind if I help out? How are you?
Good.
Did I displace you?
Sure.
This is how I have to teach. Take a sip quickly now. Oh my good. What are you guys painting?
We don't know.
Any thoughts on what you're painting? After all, it's the doctor's show. Hypothalamus, lungs. This is very important, this organ. It's sort of shaped like my two thumbs like that. It's about that size.
It's a gland.
It's a gland. The penis? What kind of penis is that? Ovaries, not ovaries. Thyroid! Thyroid, high five. Thyroid. You want to see a real thyroid? Are you up for it? Yes. This is what the actual gland looks like. Go ahead and feel that. What do you think about that?
It's like a clam. Yeah, it does.
Dried fruit? Are you hungry? It actually lies up in your neck like this. All the blood supply has got to go through that thyroid to carry the thyroid hormone to your body, which is why your pictures are so red. That's all the blood vessels carrying the hormone to you. And when it doesn't work right, it's a problem. Now, how do you guys know if your thyroid is normal or not? Is there a way you can do it while you're sitting here right now?
Sometimes a doctor just can feel your neck and know that.
That's right. Well, you know what? I'm going to show you how to do it right now. So I want you to take two fingers, your index finger and your thumb, go beneath the Adam's apple. As you sip this, I want you to, you're going to swallow, and as you swallow, you're going to feel something touch your fingers. Your thyroid gland is going to come out from underneath the big muscles in your neck. Now swallow. You got a normal thyroid. Oh, I feel yours really well. You feel right there? Okay, now you actually have a little too prominent of a thyroid. So look at Erica's neck. You see how it's a little full in here?
Yes.
Y'all notice that? That's because her thyroid is enlarged. Get your thyroid checked out. So it's the deal. Are you gonna high five me on this?
So I want everyone in the audience to do just what we showed you as well. You can do it at home, your self-exam for the thyroid. Simple to do. You're gonna find your Adam's apple. So everyone take your right hand, find your Adam's apple, the voice box. I'll put a little picture up here. I'll show you where it is, right? And that little picture will show you, see that little sort of bluish thing at the top? That's the Adam's apple. Now go down below that as low as you can, and then grab the little ridges that you feel, that's called trachea, on both sides gently, and then swallow. That's why they were sipping on the wine. Swallow. And as you swallow like that, you're gonna feel this little sort of soft, it shouldn't be lumpy or granular, thing come up and touch your fingers. Everyone do that again. Anybody nervous, scared, intimidated? Show of hands if you're worried about your thyroid. Oh, we got one. What's wrong with your thyroid?
No, well, because I have high blood pressure, so they think that maybe my my thyroid might be.
Here, hold
an
this for
issue.
1 second.
Sure.
May I do this? You mind? Okay. Swallow. And one more time.
Hold on.
Hard to,
Yeah.
Actually, I'll get you some coffee here. All right. Actually, I don't feel it to be abnormal, but we're looking for big ones now.
Okay.
Ones that are trying to overreact. That's what we're examining. If yours is enlarged, and you saw in Erica's that it was enlarged, that means your thyroid could be sluggish or working too hard. Both could happen, and it could be a hidden reason for your low energy if it's sluggish. Here's why. If this is your thyroid gland, these paintbrushes, they got to take the thyroid hormone, which is the paint, and put it on the blank canvas of your body. So if you have an underactive thyroid, everything gets sludgy like that, like the hormone. It's just sort of meandering its way. It's supposed to be like a drumstick, pounding away, pushing hormone all over the place, but it just can't do it. Very slowly. But see, the hormone doesn't come off the right way. It comes off in dribs and drabs and nothing much happens. But what you want to do is move from that to this, where you got real paint the way you want it, and then what your body does, that hormone begins to pump out of your glands because it's
pitter patter, pitter patter, pitter patter, pitter patter, pitter patter. That's a healthy body. So I want you all to practice with me. We're gonna make a little painting together. Okay. Make lots of room in here. Are you ready? We're gonna do this together? Pitter patter, ready, go. That's it, that's it. Oh, and that is a healthy thyroid, pushing hormone into the body. Are you ready? Stop. Now everyone signed this beautiful artwork. It is actually shaped just like a thyroid. So I want you to take 2 fingers, your index finger and your thumb, go beneath the Adam's apples. And as you swallow, you're gonna feel something touch your fingers. The thyroid gland is gonna come out from underneath the big muscles in your neck. Okay, now you actually have a little too prominent of a thyroid. So look at Erica's neck. You see how it's a little full in here? Yes. That's because her thyroid is enlarged. So have you ever had your thyroid checked? Today's all about giving you better ways to lift your energy, and that was Erica, the exact moment she discovered on the spot that her thyroid is enlarged, which of course is worth getting checked out with your doctor. So I asked her to be here today because I'm giving all of you the thyroid checklist. It's everything you need to know before getting yours checked. So I noticed you were sort of avoiding me that whole day. She wouldn't come forward, she wouldn't participate.
Of course
Were you
not.
nervous?
You're a doctor.
I'm a doctor.
Yeah, we stay away from you.
So what is it about doctors that make you nervous?
Every time you go in there, it's like bad news. Oh, you have high blood pressure. Oh, your diabetes is acting up. No, I'm good.
Are they making you nervous now?
Yes, I mean, my hands are clammy and I'm just like getting ready to think I'm on a boyfriend, like the whole date thing, you know? Like with a father.
Are we dating now?
Yeah.
Okay, come here. Let me go through this list for you just to comfort you a little bit. We're gonna find out if you might actually have symptoms of the thyroid that seems to be enlarged. So, tiredness, is that one of your symptoms?
Tiredness is always my symptom.
It is?
Yes.
All right, so this is the thyroid symptom checklist. It's on droz.com, easy to get it. I'm gonna check that off, okay? Now you take that pen, and let's go through these. Sensitivity to cold.
Wait, can we go back to tiredness?
Yes, 2 checks, 3 checks,
Yes.
okay? Cold sensitivity.
We get a little baby check, not that much.
Constipation.
This
Be
is
honest, please. I'm a doctor, big time, okay? Dry skin.
Oh man, have you seen my regimen? Is olive oil, Vaseline, sometimes mixed with lotion.
All 3?
Yes.
All right, weight gain?
You didn't see the puffiness? Like this is all muscle, but
I thought it was swelling, but all right. Puffy face?
yes.
You don't get hoarse, I don't think.
No.
Okay, good. Muscle weakness?
I thought that was for my gym workout.
It might be, but maybe not, just in
Okay.
case. Muscle aches and tenders and stiffness?
Yes.
Joint
You got my
issues?
kids?
No, you got
Okay.
kids? Joints?
No.
Menstruation, is it heavier than normal? I'm sorry to ask
What?
this, I know.
Oh, good gracious. Only because I like you.
Okay. How's your hair doing?
My medicine cabinet has the whole hair, skin, and nail thing because I thought I was going to fix myself.
You fix yourself?
Yes.
Well, you're going to, but not through the stuff in that cabinet, I don't think. So go ahead and check that off also. You don't seem down, but can I ask you if you are depressed sometimes?
Yes, I do suffer from anxiety, depression.
You do.
Yes.
And how about difficulty remembering things?
Middle name?
Middle name. Okay. So what we're gonna do is I'm gonna give you this whole thing. You're gonna take this to your doctor. Grab that side. All right, you're gonna take it. No. We're gonna take this page off. This is my prescription pad for you. There we are. Take this off. Take this off. And watch this. That's all yours.
Okay.
All right, fold that up. Take it to your doctor. You don't have to do that. Just leave
Okay.
this here. We're going to give you a small version of that. Everything on the list is there. All right. So again, everyone can get their own list. It's a small list. You can actually check off the boxes on a piece of paper and take it to your doctor. It'll help them identify whether you need to have a thyroid check and what to do about it. So I want you to meet Dr. Aviva Ram. She's a functional medicine specialist. She treats people who have thyroid disease, and she's really an expert at it. So what tests which people obtain if they have that kind of a list of symptoms that might be related to the thyroid?
So there are 3 basic tests that I recommend that any doctor can do in any doctor's office. Those are the TSH, free T3, and free T4.
Now, once you've talked to your doctors about these symptoms and they figure out if you get these tests, I think that people can go one step further. They can actually get the numbers themselves. You got to ask the doctor for the tests, and you have to get the numbers yourself. Why is that important?
So you want to get the test results, and then you want to see what the range is for that particular lab, because there can be some variation. But there's actually a divide amongst doctors as to when to start treating low thyroid. Some doctors will only start treating when the thyroid symptoms and the labs are kind of at a rolling boil, and the number is between 4 and 5, depending on the lab, and the patient has symptoms. But other doctors will treat when the TSH is 2.5 or over, so more when things are simmering, and there are symptoms. And actually, there's a lot of data that shows that patients do really well when they get treated when they're at that lower level. That is the thigh gap, by the way.
This is a different thigh gap.
Different thigh gap, the real thyroid gap.
Yeah.
And that's that difference between that 2.5 and that 4 or 5.
And the reason, again, this is important because the medications are pretty safe, but they can interact with other medications. So you don't want to be on things if you don't have to be on them. And the other thing I want you to do is make sure you take all the medications you're currently on, if you're on, take a picture of them. Or bring the bottles, but get that information to your doctor because those things can also interact with.
Okay.
Right? Dr. Ram, thank you very much.
My pleasure.
All right, the moment of truth. The moment I've been waiting for all show long. Now, you all remember Nicole in that little package. Nicole is Erica's best friend, and she was keeping her honest. If it wasn't for Nicole, darling Nicole, I would never have noticed Erica. She was hiding in the back. So, why do you think it's important for your good friend to get tested?
Because she's always tired. She's like, girl, I feel this way. I'm tired. I got a headache. So I'm like, go to the doctor. I don't have time. Yeah. So when you came in the room, I was like, please, get her together.
Sign her up.
Yes, thank you.
All right.
Thank you for watching. Don't forget to subscribe and turn on notifications so you never miss out on new videos to live the good life.